Imagine cutting your leg badly thousands of years ago. No antibiotics, no emergency room, no x-ray, no anesthesia, and definitely no friendly doctor telling you this might sting a little. For ancient humans, a simple injury could become a life or death problem. But here's the surprising part. Some ancient treatments were remarkably intelligent, while others probably made the original injury wish it had never happened. Let's start with the methods that were surprisingly effective and work our way toward the most extreme. Thousands of years ago, honey wasn't just something you put on bread. Ancient Egyptian healers used it as part of wound treatment, and medical texts such as the Edwin Smith Papyrus describe treatments for traumatic injuries. The basic idea was simple: clean the wound, apply a substance such as honey, and cover it. And surprisingly, honey wasn't completely useless superstition. Honey can create an environment that makes it difficult for many microorganisms to grow, which helps explain why it appears repeatedly in historical wound treatments. Ancient healers obviously didn't know about bacteria. They weren't thinking, "Ah yes, let's disrupt microbial growth today." They were simply observing that certain substances seemed to help wounds heal. The treatment could involve applying honey directly to the injured area and then covering the wound with linen. Of course, not every ancient wound survived. A deep injury could still become infected, and without modern medicine, infection could spread through the body. So while honey wasn't a magical cure, it was one of those rare ancient treatments where modern science can look back and say, okay, they actually had a point. If you lived in ancient Egypt and suffered a serious cut, you might not have gone to a hospital. You might have ended up wrapped in linen. Egyptians had an enormous supply of linen because flax was widely cultivated and used for clothing and other purposes. Medical texts describe using bandages and dressings to manage wounds. The basic principle sounds familiar even today: protect the injury and keep it covered. A piece of clean material could help control bleeding and protect the wound from dirt and further trauma. But there was a problem. Clean in the ancient world didn't mean sterile. There were no operating rooms sealed from microorganisms and no sterilization equipment. A dressing could protect a wound or introduce more contamination. And imagine trying to keep a bandage attached when you're working, traveling, fighting, or simply living in a world where there was no modern medical tape. Still, the concept itself was surprisingly sensible. Pressure, protection, covering. Three things that could make the difference between a wound healing and becoming much worse. Ancient medicine wasn't always primitive. Sometimes it was just working with an extremely limited toolbox. One of the oldest medical techniques might also be one of the most obvious: press on the wound. If someone was bleeding heavily, controlling that blood loss became an immediate priority. Ancient medical traditions recognized different ways of managing bleeding, including pressure, dressings, and other methods depending on the injury. The reason is pretty simple. Your body already has its own emergency repair system. When a blood vessel is damaged, the body tries to form a clot. Ancient humans didn't understand platelets or clotting factors, but they could see what happened when someone pressed against a bleeding wound. The bleeding could slow down. So imagine an ancient battlefield. Someone gets cut, there's blood everywhere, and instead of calling an ambulance, another person grabs cloth and pushes directly onto the injury. Not glamorous, not complicated, but sometimes incredibly important. The ancient doctor didn't need to understand the microscopic science. They only needed to notice one thing: pressure seems to stop people from leaking. Honestly, that's a pretty useful discovery. Now imagine breaking your leg in ancient Greece. You hear the crack. You look down. The leg is definitely not pointing in the direction legs are supposed to point. And there is no orthopedic surgeon waiting around the corner. Ancient physicians nevertheless developed methods for dealing with fractures. The Greek physician Hippocrates and later medical writers described techniques for manipulating broken bones and using splints or bandages to help stabilize them. The process could involve pulling or manipulating the limb to bring the bones back into better alignment. And yes, that could hurt a lot. Without modern anesthesia, some procedures would have been performed while the patient was fully conscious. Once the limb was positioned, it could be immobilized so the bone had a chance to heal. This was an important realization. A broken bone doesn't necessarily need to be replaced by an artificial one. Sometimes the body can repair it itself if you keep the pieces in approximately the right place. The problem was that ancient doctors had no X-rays. They couldn't look inside the body and check the alignment. They had to rely on touch, observation, experience, and occasionally pure confidence. And if they got it wrong, you might survive but walk differently for the rest of your life. Now things start getting considerably more uncomfortable. One ancient method for controlling severe bleeding was cauterization, essentially using heat to damage tissue and seal blood vessels. The principle isn't entirely irrational. Extreme heat can destroy tissue and help stop bleeding. But imagine what this meant before modern anesthesia. There is an open injury. Someone brings a heated object toward it, and then they press it against your flesh. That's not a medical procedure that needs a dramatic soundtrack. Your screaming is already providing one. Cauterization was used in different medical traditions across history, and its applications varied. It could sometimes be useful when bleeding was difficult to control, but it also caused burns and additional tissue damage. And without modern infection control, every additional injury carried its own risks. Still, ancient healers were discovering something important. Sometimes stopping the immediate danger mattered more than preserving perfectly healthy tissue. If the choice was uncontrolled bleeding or severe damage from a heated instrument, the decision could become brutally simple. Survival first, comfort later. Assuming there was a later. Ancient surgeons didn't always avoid cutting into the human body. They sometimes had to. Different civilizations developed surgical procedures for injuries, abscesses, wounds, and other conditions. Ancient Roman military medicine, for example, became increasingly organized because armies constantly produced injured soldiers. Surgeons could use specialized instruments designed for cutting, probing, extracting, and treating wounds. Archaeological discoveries have even revealed surprisingly sophisticated surgical tools from the ancient world. But here's the part that makes the whole thing terrifying. Pain control was extremely limited compared with modern surgery. Ancient physicians did use substances that could alter pain or consciousness depending on the culture and period, but there was nothing comparable to modern general anesthesia. So some procedures that today might take place under controlled anesthesia could historically involve a patient who was conscious or only partially sedated. You weren't drifting peacefully into sleep while the surgeon worked. You might be gripping something. You might have people holding you still. And you definitely weren't asking for a 5-minute break. The surgeon's greatest enemy wasn't just the injury. It was also infection, blood loss, and the limitations of human pain tolerance. Now we reach one of the strangest practices in ancient medicine: trepanning. This involved creating an opening in the skull, and humans were doing versions of it thousands of years ago. Archaeologists have discovered prehistoric skulls showing evidence of trepanation, sometimes with signs that the person survived long enough for the bone around the opening to begin healing. Why would anyone do this? In some societies, it may have been associated with head injuries. In others, explanations could have involved spiritual or supernatural beliefs. And in some cases, we simply don't know. But imagine being the person undergoing the procedure. Someone has decided that the solution to your problem is a hole in your skull. There were different techniques, including scraping, cutting, or drilling through the bone. The tools were obviously nowhere near as sophisticated as modern surgical equipment. And yet some patients survived. That is one of the most fascinating parts. Ancient humans weren't simply helpless victims of disease and injury. They were experimenting. They were observing outcomes. And sometimes they discovered that a procedure that sounds absolutely horrifying could actually work. Unfortunately, survival was never guaranteed. A skull wound could lead to infection, brain injury, bleeding, or death. But the evidence of healed skulls proves that at least some ancient patients made it through, which means somewhere in prehistory, someone looked at a skull and thought, let's try opening that. And somehow, occasionally, they were right.